Good afternoon, everyone. Welcome to the November Food Security Community Call. I'm Annmarie Hart-Bookbinder, the Food Security Programs Manager here at the Montgomery County Food Council. I'll just give everyone a minute or two to get in from the waiting room. It's just 1 o'clock on the dot now, but I can't believe we're the week before Thanksgiving already. And so I really appreciate everyone's time here today. Hi, Mary. Okay, so let's just keep letting folks in. And while that is happening, I will share our agenda in the chat. I'm going to get started in just a moment, just letting everyone in. Okay, wait room has slowed down, so I think we will get started. Thank you, everyone, for joining us today on our November Food Security Community Call. I've shared our agenda in the chat. We'll share it again in a few moments for those of you that may have missed it the first time around. But just thank you all for being here today. I know the busy time of year this is for everyone, so really appreciate your time in joining us today and participating in this call. We are going to kick things off right along with our first presentation. I did see her come in the room. Samantha Perez from the Capital Area Food Bank wants to share a little bit with us briefly about the partnership that they formed with our SNAP team for referrals and how those of you that are Capital Area Food Bank partners can participate in that process. So Samantha, I will turn it over to you. I'm going to make you a co-host here because I know you have some slides you'd like to share. So thank you for joining us today.
Thank you so much for having me. This is my first time joining this call, so I appreciate you sharing just a couple of minutes with me so I could talk about this partnership we have started. Navigating to my slides. Okay, you guys can see that, right?
Yes.
Okay, perfect. Okay, so I am with Capital Area Food Bank, and you'll hear in a minute how this partnership started. But we're talking about a new process for both, Capital Area Food Bank partners and any food assistance organization to refer folks to get assistance applying for SNAP. There we go. Okay, so my role here at Capital Area Food Bank is working with this system called Service Insights. It is a web-based client intake system that we offer to our CAFB partners. So you'll see our email address at the end of this if you are a food bank partner and you're interested in learning more about using this. But one of the questions on this digital intake is about folks' SNAP benefits. And the whole point of this system is to use data to make more client-centered decisions. So, that's the goal behind this whole process, and especially the SNAP benefits question. We want to have some follow-up action to help folks who may qualify for SNAP but don't have it for whatever reason. So since at this time, our food bank doesn't offer client management or benefits navigation for community members, we still want to make sure that we're putting this data we're collecting to good use. So to that end, we started this more specific work with Montgomery County Food Council to direct clients from CAFB partners and any food assistance organization to MoCo Food Council for SNAP application help. So how does this work? My colleague Jake Harris created this form you see on the right-hand side. It's titled SNAP Application Assistance. And this is a very simple paper roster that you can use if you want to, totally not required, to collect a little bit of information from people, to share it back with MoCo Food Council for them to do that follow-up. So you'll receive all this in an email. You're going to get this document, which has English on one side, Spanish on the other, and some bilingual eligibility flyers explaining to folks how they're eligible for SNAP. So you'll have this on hand at your food distribution. If clients want help applying for SNAP, we encourage you to share this roster with them for them to write down their information. It's a little hard to see, but it's asking for first name, last name, phone number, and preferred language. When you have this roster full, or at any time, you can scan or take a picture of it and email it to this email address. It's snap@mocofoodcouncil.org. If you're a CAFB partner, we'd love for you to check the little box at the bottom saying that you are, just so we can keep track of who's participating, and certainly shred the roster when you're done to help protect people's information. Some FAQs here at the end. As I mentioned, this process is available to any food assistance provider within Montgomery County. You don't have to be a food bank partner to participate in this. Is this process required? No, this is totally optional, only if you have the capacity to participate in this process. And if you want to, it's not required at all. Lastly, I mentioned Service Insights is that digital intake platform that is available to our food bank partners. If you're interested in learning more about that, we'd love for you to email us at this email, serviceinsights@capitalareafoodbank.org. We'd love to show you more about it and let you know how you can get involved with that. And with that, that is the end of my section. So I don't know how it normally goes. You can let me know, Annmarie, if we're taking questions now. I can also answer questions in the chat, or we can just direct folks to my email here.
Thanks so much, Samantha. Yeah, we have a minute or two if anyone has any questions about this process. If not, we can certainly move on. It's not your only chance. You can always ask them in the chat, or we can follow up with Samantha after today's call and get them to her. But I'm certainly happy to provide a moment here if anyone has any questions on the spot.
Actually, I have a question. So I'm from the student council at universities at Shady Grove, and we struggle a lot with having hot food on the campus. So we have the vending machine and the frozen food, and a lot of students complain a lot about it. And it's not like we did not have hot food on the campus, we had it, but because we had so many less people buying it, we had to rule that option out. But now we are getting a lot of complaints every other day, and it's like a very big issue. So how can something like SNAP actually help Shady Grove's problem of having hot food on campus? Is something I would like to know.
Sure. So I would say, so SNAP is a government program that basically gives people money to buy groceries at a supermarket. So I'm not sure it would help your challenge with hot food specifically. It's more for individuals to get food for them to prepare at home. Annmarie, do you have anything to add?
Yeah, I think, Kushba, we'd love to connect with you offline too, with our SNAP team, Allison Schnitzer and Elisabet Tuin, just to talk about that whole referral process and how you can connect students that may be eligible for SNAP. I think, different food assistance programs would be a separate conversation from that, but really what we're looking to do here is just check and make sure that any residents that are connecting with food assistance providers for distributions are also getting the opportunity to connect to see if they can be screened, if they would be eligible to receive SNAP benefits, just to make sure that we're providing another connection point at those different distributions to make that happen, because that is our ultimate goal, knowing the resource restrictions that we do have in the county, and we want to make sure that people are connected with any benefits that they may be entitled to receive. So like I said, happy to follow up with you more after the call on that, but that's what we're just focusing on with this presentation, if that helps.
Thank you. That helps.
Great. Thanks for joining us today. Any other questions about the resources that Samantha shared, or kind of doing that? If not, I'm happy to move on to our next presentation. And thank you so much, Samantha, for joining us today. Hope you can stay with us and that we see you again soon. Okay, we are going to move on to our next speaker, and that is Elisabet Eppes with Maryland Hunger Solutions, who's going to share with us about the latest Montgomery County hunger profile. So Elisabet, I see you there. I'm going to make you a co-host in case you have anything you want to share on your screen. And again, thanks for joining us today.
Thanks so much, Annmarie. Yes, I would like to share my screen, so I'm going to do that in a second. But I would request, Khushbu, if you could put your email in the chat. I would also love to follow up. We have Maryland Hunger Solutions has our Campus Hunger Network that we are definitely always looking for ideas for improving food access on campuses. So we would love to follow up with you and invite you to our next network call if you haven't been joining those. But hi, everybody. My name is Elisabet Eppes. I am with Maryland Hunger Solutions, and I'm going to take just a few minutes today to share about our latest hunger profiles and specifically touch on the Montgomery County hunger profile. So I'm going to start my slideshow. Can everybody see that? And are you seeing the slides? Or are you seeing the presenter mode? Hopefully you're seeing the correct, you're just seeing the slide.
I see slides.
Okay, perfect. Thanks, everybody. All right. So yeah, I'm going to dive right in. And I think most folks on the call today are probably familiar with Maryland Hunger Solutions, but just in case, I did want to quickly introduce ourselves. So we are a statewide anti-hunger organization. We work really closely with the Montgomery County Food Council, but also work closely with other county and city level organizations across the state. And we do a combination of education, advocacy, and we also are involved in direct outreach, specifically related to the SNAP program. But we really, our advocacy and education is on all of the nutrition programs in our state. And so the hunger profiles is a report that Maryland Hunger Solutions puts out annually. We provide updated data on SNAP, the K through 12 nutrition programs, as well as WIC. Each profile also contains information on the population, median household income, and percentage of people living under the federal poverty level, or FPL. And the profiles include a state level profile as well as for each jurisdiction. So all of our counties, as well as Baltimore City, each of our jurisdictions has their own profile. And in the beginning of the report, we also provide a section that defines terms and provides descriptions of all of the programs that we talk about. There's a lot of acronyms, and we do get into kind of details in this report. So it's nice at the beginning to have kind of the definitions laid out. And I've included the link here. I can also, when I'm finished, I'll put a link to the report in the chat. So we see the purpose of our hunger profiles is data is powerful. Having the latest data on food insecurity, poverty, and the participation levels in our different food assistance programs is extremely powerful to telling the story of hunger in our state and in each of our counties. And we see this as something that can be useful in conversations with policymakers, as well as, our partner organizations and the general public. And we know that the Maryland hunger profiles are a complement to other data reports that are put out, for instance, by the Maryland Food Bank and the Capital Area Food Bank. We know that that our partner organizations are putting out reports on food insecurity in the state. But to my knowledge, to our knowledge, the Maryland hunger profiles from Maryland Hunger Solutions are the only one that paint a picture of all of the different, or I should say several of the most prominent federal nutrition programs, being SNAP, WIC, and school and out of school time meals. So we really see it as a one-stop shop for getting kind of an overall sense of program participation. And before I dive into the hunger profiles themselves, I want to note our data sources. So for any information on population, income, and poverty, we're drawing that information from the census. For free and reduced price meals enrollment, and CEP is the community eligibility provision. That information is coming from the Maryland State Department of Education. Our SNAP data is coming directly from our Department of Human Services, and our WIC data is coming from the Department of Health. And I wanted to note those things because the methodology that our state agencies use in calculating participation can sometimes be slightly different than if you go to a national level report. So for instance, my background is in WIC, so I'm very familiar with WIC data. And if you look at WIC data on the national level from USDA, they may report slightly different numbers than what we're reporting here from the Maryland Department of Health. And if you have questions about that, I can definitely talk offline. But just in case you see a number here and you say, oh, this is slightly different than what USDA is putting out, it's because the way that participation is calculated by the state agency is slightly different than USDA. So before we talk about Montgomery County, I wanted to paint the picture of Maryland as a whole. And this is, so we updated this report over the summer, and this is the latest data available, for all of these different data points. But our population in the state is just over 6 million. Our median household income is about 90,000. And then as far as percent of the population living below the federal poverty level, this is 2021 data, we're at about 10% of our state population. And then as far as child nutrition programs and looking at free and reduced price meals, we see we have nearly 900,000 students enrolled in public schools in the state of Maryland, and roughly 54% of those students qualify or are enrolled in free and reduced price meals. I should just note, through advocacy from Maryland Hunger Solutions and our partner organizations, we no longer have the reduced price meal category. All students who qualify for free or reduced price meals are getting meals at no cost. So I just want to note that that yes, anybody who is enrolled is getting those meals for free. And then the community eligibility provision, we have 727 schools that are eligible and 351 schools at the state level that are participating. If you have questions about the community eligibility provision, if that's something you're not familiar with, I know my colleague Julia is here on the call. She is extremely knowledgeable. So if you have questions about that, but basically that's a provision from the national level that schools and districts can opt into if they meet a certain eligibility threshold of students who demonstrate poverty in their school. And it means that all students at the school or the district are going to get free school meals. SNAP participation at the state level, we are currently hovering around 660,000 average participants per month in the state. And then as far as WIC, we are at about just over 180,000 participants in the state, and our coverage, our WIC coverage is about 75%, meaning 75% of eligible women, infants, and children in the state are enrolled in WIC. And the two other charts I want to go through, the one in the top right-hand corner is total SNAP participants this is from 2011 to 2023. And this is in the state of Maryland. This graphic is directly from our Department of Human Services. So you can see that kind of during the early days of the pandemic, we saw a spike in SNAP participation around between January 2020 and July 2020. And then it remained pretty high, close to, I think it's kind of hard to read those numbers, but it's like over 800,000 participants per month. And then we see it went down pretty dramatically kind of in 2022, and now we've hit a bit of a plateau at the state level for SNAP participation. And WIC participation, this, excuse the typo, that should say participants. This is actually the national level. I think if I had more time, I would put together a state level chart, but we know that WIC participation, after many, many years of decline in WIC participation at the national level, in the last year or two, that participation has started to increase, and Maryland is reflective of the national picture for WIC participation. So we're finally seeing kind of an increase in WIC participation in our state, and that's related to a number of reasons, which I won't get into today. But to get into Montgomery County specifically, so the population is just over 1 million people. The median household income is $117,000. So we know that Montgomery County is a little bit wealthier than the state average. And then if you look at the poverty level, similarly, the Maryland state level is in purple, and the Montgomery County is in pink. So for the total folks living below the poverty level in Montgomery County, it's about 8.6% compared to 10.3% in the state as a whole. And for the nutrition programs, again, kind of reflective of the fact that Montgomery County is a little bit wealthier than the state as a whole. The percentage of students who are enrolled in free and reduced price lunch is slightly lower. It's 44%. And there are no schools participating in the community eligibility provision in Montgomery County as of this past summer. And just to go over SNAP and WIC, SNAP participation in the county is just over 63,000 participants per month. And I wanted to note, I forgot to mention this before, but in the state of Maryland, roughly 11% of our population is participating in SNAP, so about 1 in 9 people. In Montgomery County, it is significantly lower. It's 6% of the population is participating in SNAP compared to 11% at the state level. And then for WIC, there are just over 30,000 WIC participants in Montgomery County, and the coverage rate in Montgomery County is significantly better than at the state level. So there, of the eligible people in Montgomery County, just over 85% of people are enrolled, which is great. And I think that about wraps up the information that I wanted to provide today. But as I said, we are here to provide any more information on any of these programs or answer any questions you have. And I know my colleague Julia is here. I want to give Julia just a second in case she has anything to add. I know I went over time a little bit, but Julia, let us know if you have anything to add or if I made a mistake.
Yeah, I just wanted to flag one data point on there. So when we updated this report, it was in the summertime, so it's reflective of last school year. I will just mention that this current school year, Montgomery County has brought on some CEP schools. So I believe, someone correct me if this is wrong, I believe there are 59. Is that right, Annmarie? Yeah, so there are 59 new CEP schools in Montgomery County, which is fantastic. So that's the only, I think, update I will give.
Thanks, Julia. I thought that was incorrect. Yes, so that data is from last school year. So thank you.
Thank you so much, Elisabet and Julia. Anyone have any questions on that presentation? I know it's a lot of information, and you know, some of us will kind of need a little bit of time to sit with it and think that through, but any questions, happy to spend a few minutes with that here.
Annmarie?
Yeah, hey, Tom.
I have a question. Do you have any data on the Farmers Market Nutrition Program or the Senior Farmers Market Nutrition Program? Those are USDA programs that Maryland administers that are of special interest to those of us who are farmers selling at the farmers market.
So I don't think that I'll let Maryland Hunger Solutions address if that's ever something that they consider in their hunger overview. But if not, we do usually we have participants from the Maryland Market Money Program on this call. I don't see them here today, but we can certainly get that data for you, Tom, from them.
Yeah, I could jump in really quick. That's a great question. That's not one of the programs that we include in our hunger profiles, but if there is a strong desire for us to track that, we can. There are some other nutrition programs that are also not included. So for instance, the Child and Adult Care Food Program, we know that provides food in after school and in childcare settings. That's not included in our report either. So there are some nutrition programs that we probably could include if we wanted to. So thank you for flagging that.
Yeah, and just to make sure, Tom, that I got your question right, because I realized I probably only half answered that. You know, there's the Maryland Market Match. And then obviously you had mentioned the senior program. That's probably something we would have to coordinate with the county on getting that information, because I know they're the ones who distribute it. I don't know how that information is then tallied in terms of how they are applied, you know, like what the usage rate is versus the distribution. But that's something we could certainly look into, Tom.
Well, and at the farmers market, we see farmers market nutrition program checks. We see senior farmers market nutrition program checks. I'm qualified to receive both, but I'll tell you, there's very little action. And I think there may be a publicity issue there. It's also true that with the hubs in Montgomery County, people have access to food distributions that are maybe more convenient or local for them, and they may not feel a need to go to the farmers market for that. But we'd like to see more of those people at the farmers market, and just wondered what the utilization was. I think many of the food programs, overlap and, in a way can take traffic from one another, see what I'm saying? So the whole picture is, I think, helpful to have to really know where we are. Thank you.
That's a great point, Tom. Thanks so much for sharing that. Any other questions for Maryland Hunger Solutions? Yes, Lauren, Sarah Servin, our friend from Crossroads Farmers Market, who is now with the Maryland Department of Agriculture and working about the redemption programs at markets. Yes, she would definitely be a great person for us to connect with on that issue. Thanks for the reminder. Okay, moving along, we are going to move to introducing Juan Cruz and Catherine Nardi from the Office of Food Systems Resilience to share about the Food Assistance Provider Landscape Survey, and just give us an update on how that process went.
Good afternoon. Thanks so much for having us. My name is Catherine Nardi. I'm a program manager in the county's Office of Food Systems Resilience. We are a relatively new office in county government, having launched in February of this year. And myself and my colleague Juan, who will introduce himself in a moment, were both hired just in August of this year. So we are new to the team, but not new to the space. I'll let Juan introduce himself real quick and then we'll jump in.
Yeah, hey, how's everyone doing? It's good to see some familiar faces. My name is Juan Cruz. I am the performance management and data analyst here in the Office of Food Systems Resilience. Before this work, I worked many years in DC government and basically in large data projects, data governance, and then data analytics and data science and a bit of business intelligence. So just a little bit of everything, but new to the food space, but not to the data world. So happy to be here.
Awesome. So the Office of Food Systems Resilience, as I mentioned, was just launched in February of this year through legislation passed by County Council at the request of the county executive. And the purpose of our office is really to build on the lessons learned during the pandemic to streamline and coordinate county efforts to address food system challenges. So we are tasked with developing and implementing budgetary, regulatory, and operational strategies that help to build a more equitable, efficient, resilient, and sustainable food system here in Montgomery County. We launched a survey in September of this year in partnership with the Food Council to kind of collect a baseline understanding of the food assistance landscape in Montgomery County. The survey was distributed to over 100 food assistance provider organizations, drawing on contact lists from the Food Council and leveraging our relationships with some of the food assistance providers in Montgomery County to disseminate it out to their colleagues. We had a total of 83 responses and 73 complete responses, meaning that the other 10 organizations included in that total number of 83 responded to some of the required questions, but not all of the required questions. So we have 73 complete responses to go on. And we asked questions in this survey related to when these organizations are distributing food in terms of the date, day of the week, time, the format in which they're distributing food, whether it's prepared meals, pre-packed bags or boxes, if it's a choice pantry style, and then the locations that they are serving. So not just where their distribution site is headquartered, but also which zip codes they have other distributions in. We also asked around how they are funded, where they get their food from, the types of data that they're collecting internally in terms of how frequently they're having distributions, how many people are coming to the distributions, and also what data they're collecting from clients. So if they're asking clients about their zip code, their demographic information, dietary preferences, all those different types of things. And then we asked for year-to-date data from each of the respondents around how many Montgomery County residents they are serving, how much food is getting out into the community. That will help us to kind of better understand what the reach is of our food assistance network. And then also asked about additional services provided, whether it be financial literacy information, SNAP outreach, SNAP enrollment, nutrition education, or referrals to other organizations.
Yeah, so as Catherine mentioned, this is a work that we've done to be able to quantify the reach of food assistance providers, be able to get a sense of the resources, get a sense of where are services being provided, and basically be able to tell the story about food assistance providers to others that might be even outside of this call, right? I think some of us here would know a lot of this information, but I think it's different to be able to put all of it together and then be able to provide that information to others outside of this group. So one of the highlights, we are still in the analysis part of this survey. There was a lot of questions, and so we're working through that. But I have a couple of highlights that I want to show you of what we've collected so far. So one of the things that we really drove that came out of some of the data set that we were analyzing is that most assistance providers really have a lot of deep roots in Montgomery County, right? And so we saw that here, 68% of the organizations have been doing this work for over 10 years. So this means that, this is not something that just people showed up after the pandemic or all this, but these were folks that were laying the groundwork for for this work and this assistance, and then the investments of the county can be seen in the future as well, and knowing that they're investing in people that are invested in the community. So the other highlight here is around the service offered, right? We wanted to understand the capacity for service providers to use referrals as a other way to offer wraparound services. So here we found that 68% of the providers share information about other services, but without any sort of tracking or formal follow-up, but rather just providing that information. Around 10% are able to monitor that referral and follow through on that referral, or even check back on that referral to see what happened at the end of it. This is just a question about capacity, right? So we're trying to just understand what's the sort of state of the union on this type of work. So I'll just kind of give a little bit of time for folks to sort of process this yet, and I'll move on to the next one. And this is the one that I was interested in, because there were a lot of questions around data and what is the data knowledge of our food assistance providers. And so we asked that question. We said, how would you rate your data knowledge, right? And so we provided here on the right-hand side, you can see what this beginner, intermediate, advanced, beginner, advanced is for assistance providers to take a look at it and see where they fall in these categories. And about 52% of them rated themselves as advanced or advanced beginner. And so again, this is, I think, another opportunity as thinking about if we wanted to introduce things like be able to quantify our work in a better way, be able to provide more tech products to our assistance providers from the county side that can support their work, and know that there is at least a data knowledge enough that we can move. So this was again to get us a baseline for where to best support and where to best provide support for our food assistance partners. So we just wanted to give you a quick snapshot, but of course there will be more to come, and we want to continue to share this information as we're able to process it. In the meantime, you can get in touch with me. There's my email, and also with Catherine here in the Office of Assistance Resilience. So thank you, and I'm happy to answer any questions.
I don't see any questions currently in the chat, but if you have one that you'd like to share, please either share it there. I'm happy to read it out, or raise your hand. I also invite you to think about, if you participated in this survey and you remember some of the questions, what would you, maybe you could share with Catherine and Juan, what would you like to see come out of that, that exercise data-wise? What kinds of questions were asked that made you think to yourself, hey, it would be really helpful for me to know this about other providers, or, on a county level? What were the pieces of information collected that would be useful for everyone to have access to on a county-wide scale?
Yeah, and this won't be, to add to what Annmarie said, this won't be the only time you'll obviously get to provide that input. We are hoping to convene groups of food assistance providers to have work sessions as we think about what does a better reporting look like on these efforts? How can we best support the data collection of these processes? And so we're hoping in the future to also have convening groups and be able to discuss data collection practices, and even come up with a list of things that we can collect as a group that makes sense for us, and that are not burdensome, but that do provide a good snapshot of the type of work that you all do.
And just responding to Samantha's question in the chat box. So yes, we will be sharing a summary of the survey data once we're at the point of having it ready to go. But until then, if you have specific questions, you can feel free to reach out to either of us.
Awesome. Thank you.
Okay, I'm seeing a few comments pop up in the chat. So mostly just thanking and great to have this information. Jenna wrote that she'd love to see data segregated by geography in some way so we can see what capacities are in certain zip codes or neighborhoods. And Dana is asking, what are the next steps for your office, particularly in terms of improving coordination among providers and ensuring that those living in the areas in most need are able to access food?
Yeah, these are good questions. Yes, I think we also are planning to use the data to get a better sense of how different zip codes are being served currently and identify if there are gaps geographically in the distribution of food assistance services, so that as we are working with food assistance providers to improve coordination, to Dana's point, we can really use that to guide our efforts and to understand where the need is and where we need to redirect services and resources to. I think, as Juan mentioned, we'll be planning to kind of convene food assistance providers, likely, in partnership with the Food Council, in some way to really better understand, I think as a follow-up to the food assistance provider listening sessions that already took place this year, what additional support is needed and how we can leverage the results of the survey and the data that we're collecting through the survey and other data that Juan is pulling together to really enhance and strategize around our food assistance approach in Montgomery County, so that it is more efficient, that we're maximizing the resources we have access to, and that also, we're acting in awareness with and alignment with the capacity of the food assistance network, and recognizing that there are, clearly 80+ organizations out there doing the work currently. So how do we use this data and use this information to make sure that each organization is not, and no one organization is overburdened with responsibility, and that each organization has a role to play.
Yeah, I would agree. I would add that, in our effort to build resilience in the system, our ultimate goal is really to increase the capacity and support the capacity of food assistance providers. So it's not just that a few rise, but that we all rise at the same time. And so we just that's why our first is to create a baseline to understand the need and to understand where we can be most helpful. And then also to be able to then align county funds specifically to something that would actually help food assistance providers to continue the work, and then, add more fuel to that work. So yeah, we're just hoping to, at a later time, convene folks together and really brainstorm about ideas on how to do that.
Thank you so much, Catherine and Juan. If there are any other questions, happy to take a moment here. If not, again, not your last opportunity to ask questions, to kind of share feedback or hopes for the future. And we certainly look forward to working with OFSR to convene those spaces in the future, about how we can all work together, to meet data needs and what that tells us about food assistance needs in the county moving forward. So thank you, Catherine and Juan, for your time today. And thank you for that great lead in to the listening sessions that the Food Council did host back in September. We hosted 3 listening sessions that were attended by a total of 50 representatives from different food assistance providers, community organizations that provide food as a component of their programming, and some members of our Food Security Community Advisory Board. So I want to first thank all of you that participated in these sessions for sharing your experiences and your expertise on a variety of subjects relating to the delivery of food assistance programs in the county. And in a moment, I'll start sharing my screen, and I'm glad to be sharing here with you today the highlights of what we learned in those sessions. Greatly appreciate your joining us today during what, again, I know is a really busy time for you all, to hear that feedback and to discuss how we can move forward as a community in the coming year to address some of these opportunities and challenges. So just give me a moment to start sharing my screen, and we can move into that. Sorry, wrong screen. Too many bullets, too many screens open as usual. There we go. So for those of you who weren't able to join us, or who maybe just need a little refresher on what it was that we discussed during these listening sessions, we talked about providers' ability and the resources needed to meet community needs. We talked about programs that were successes or where there were opportunities for improvement in the county. We talked about ways to better support residents experiencing food insecurity, the challenges you face in obtaining participant data, the data that you use to evaluate services, and the methods and challenges you have in connecting clients to services beyond food assistance. And you can see that some of this is really kind of digging in for more of those real life experience stories that you also provided some technical information about in the landscape survey that OFSR ran. So what did you tell us that you are experiencing? First, the number of residents seeking services remains high or is even higher than what you were experiencing during the height of COVID. And this we know is due to the high cost of living in Montgomery County. For those of you that have either seen our childhood hunger report or the new self-sufficiency standard, as being about 400% of the federal poverty level in Montgomery County. So definitely high cost of living here. We know that inflation, is a major issue affecting both the purchasing power of residents as well as providers, when you are making purchases of food resources to provide in the community. The return to pre-COVID federal nutrition benefit levels and application requirements, again, people having their benefits reduced from where they were at a high point during COVID, a lot of those access barriers going back up in terms of application requirements, reapplication requirements, things like universal school lunch, nationwide, going back again to pre-COVID standards. And then the end of ARPA funding, which had really allowed local municipalities to fund additional programs for food assistance resources. The way that you shared with us that you are meeting, continuing to meet resident needs as a result of all of this, what's happening? You're running out of food during distributions. Many of you are having to reduce the amount of food that you're providing per household per distribution. Some of you are not able to take on new clients at this time. Some of you may be switching from drive-through distributions to appointment systems to be able to better manage the influx of clients seeking services. And some of you also reported that residents, as a result, are having to experience longer waits to receive services such as food and meal delivery, kind of all of those extras that, extra level of service that some clients might need. There's a longer delay in being able to access those. Some of the needs that you identified that would help you in providing additional services to residents include more access or availability of dry and cold storage, transportation vehicles and drivers, staffing, predictable and applicable funding streams, additional food resources, language resources, designated office and indoor distribution space. And many of you also cited the need for a countywide coordination and strategy. We'll come back to these in a few minutes. We also asked you to share, like I said, where there were some successes in the county and where there were some opportunities. So for successes, many of you referred to the direct food purchasing program, the availability of ready-to-distribute boxes of produce and pantry items, the creation of the service consolidation hubs, the farm to food bank program, and just on the whole, anything that provided greater access to fresh, culturally relevant produce. Those were all seen as some of the real successes during the past couple of years. Where you felt that there were opportunities, again, the direct food purchasing program, right? So not one size fits all for everyone. So, some things that are working great, some things that could be improved. The federal SNAP program in terms of the amount of benefits and access issues. Resident lack of awareness of programs access, and also a resident's inability at times to provide the necessary information to participate in programs, the stigma they might feel about accessing them, and their lack of transportation that might be necessary to access programs. You were concerned about a heavy reliance on volunteers and the fact that, particularly we had a high point of volunteerism during COVID, and that's kind of, again, returning to those pre-COVID levels, that people are not as available or focused on volunteering right now as they were. And also the drawbacks of offering a low barrier service model, that while, again, many of you agreed with that philosophy of offering a low barrier service model, but feeling that it also really prevented you from being able to truly gauge the depth of need that an individual resident or family might be experiencing when it comes to food assistance. Ways that you felt we could work together to better support residents included advocacy to improve levels of federal nutrition benefit programs, the creation of a unified data collection system, improved communication channels, a unified case management system, support in identifying and applying to grants, overall in the county, taking a more holistic view to get at the deeper issues as to why residents are in need, local provider coordination, and provider peer mentoring. And again, we'll come back to these two in a moment. We talked a lot about the challenges that you experience in obtaining data from residents. And this was attributed to, again, major issues here: language barriers, client reluctance to share their household information. Some reported that clients can find the questions being asked to be demoralizing. Some clients are lacking appropriate identification that you might need. Providers themselves are lacking the necessary equipment, training, or staff to be able to participate in these activities. Some of you are, again, relying on volunteers. Some volunteers are very reluctant to probe residents for this kind of requested data, not feeling comfortable with that process. We noted that those of you that operate on a grab and go model have more challenges collecting data than those who are operating on an appointment system. So again, your method of distribution could add to your challenges in obtaining data. And then many of you just have a lot of additional grant reporting requirements. So you're collecting different pieces of information for different grant requirements that you're operating under. And again, this kind of just adds to the amount of information that you are asking people to provide, and that's going to create challenges in seeking other information. A question that rose up in this conversation from one of our providers was that, is there a way to partner with hubs to share client data locally? So again, just sharing some highlights as I have them, but that's something we can come back and talk to a little bit more in our discussion as well. Data that is being used by providers to evaluate services. Many, if not all of you, are collecting process data. So things like the number of households you're serving, how frequently clients are visiting you for resources, the pounds of food distributed. Many also, again, relying on informal client feedback. Some of you, again, that operate, usually more that are operating on an appointment system, are reporting a lot more success in obtaining feedback via written or oral surveys. Again, a lot of language and literacy barriers in this area. But some did comment again, if there was a way to work together to ensure the design quality of surveys, that sometimes a poorly designed survey is, worse than not having a survey at all. So, is there an opportunity within this space to maybe, work together to design surveys that meet everyone's needs and are more scientifically structured? Ways that you're connecting residents to other services. So many of you are sharing indirectly flyers on your website, on social media, with all different partner representatives at your distributions. Some of you are lucky enough to have caseworkers on site who can handle that function. Some of you have staff members or volunteers who have experience in that area and are comfortable and have the availability to work on that with you. And some of you are also lucky enough to just be co-located in your office space with other service providers. And so you're able to physically walk, a client over and connect them with another set of services that could be of benefit. Barriers that you're experiencing, again, lack of trained staff, lack of interpreters on site, client inability to participate in this process. And this could be for, again, a number of reasons. Do they not have an understanding of the information that they need to provide in order to access programs? Do they not have documentation that they need to participate in programs? Do they lack transportation in order to access these programs? So they could be a number of different barriers that they're experiencing. And non-existent or outdated guides to the available resources or programs that are available for county residents to take advantage of. Many of you cited different resource guides that used to exist in the past based on a very particular focus. So there used to be a resource guide to housing in the county, used to be a resource guide to maybe job training or something. So again, those either not existing anymore or being outdated. So what I'd like to talk about here in this space, and again, this is really just I realize I'm sharing a lot of information with you. This is the first time, some of this is coming back. I feel like, though, if you've been in this space and as we've seen from Juan's and Catherine's presentation, many of you have been doing this for more than 10 years. And I'm sure many of these issues you are still very familiar with and you've been experiencing during that time. And so while it might be a lot to kind of take in all at once in this space, I'm sure many of you have been thinking about these for a long time and working within those areas. But what I'd like to discuss here today, or start a discussion about, is which of these issues really lie within our power as a community to work together to address? Which of those issues do we want to prioritize? Which of them have resources, which of them may be connected to resources that already exist and just require better coordination or implementation as opposed to doing something entirely new? Who in our community has expertise in these areas? And who's interested in contributing to this work? I know for many of you, many folks on this call really joined our community during COVID when our meetings kind of switched from the Food Recovery and Access Working Group that was meeting in person prior to COVID and was working on implementing the county's food security plan. And our calls really kind of switched in focus to sharing more about resources and opportunities. And while that also happened during those in-person meetings, we kind of shifted a little bit away from working together in this space. And my goal for, next year is to kind of bring us back to that a little bit and see how we can work together, like I said, to kind of work on some of these opportunities and barriers that you all may be experiencing in the community. So I'll bring back up again kind of what I saw in that feedback as opportunities, as areas that you wanted to work on together, that you felt needed to happen in the community. I highlighted just in a pale yellow here. I really want to hear from you today. But I highlighted what I thought in my mind were some kind of low-hanging fruit that we could definitely take on together, that the Montgomery County Food Council would be happy to, create space for and create arrangements for. So I'm going to stop talking now. I will leave this up a little bit so you can see this and take this in. But I am really just looking forward to hearing from you all now and, kind of how this sits with you, what you are thinking about, and those areas that you would want to prioritize in our space. Deanna.
Thank you, Annmarie. Great results of the survey. I'm wondering whether within the survey you have information on the importance of the responses, or whether you have data sorted by which choices were made by more partners. So I'm looking at the needs, basically thinking about the needs and the challenges and a way to prioritize them. Whether more partners chose dry cold storage, as a need,
So
or
what
yeah.
we're talking about now, because this is all collected from our listening sessions,
Okay.
I don't have exact, how many people specifically said this or that. These were just kind of the overarching themes that popped up. And I think it's something that we would really want to, work on together in this space is, what is the importance that people feel. Like I said, this is just my first time introducing this all to the group. This is just to get a gut reaction, to get people thinking. We are not going to have a December call, but we will meet again in January. And I am hoping to use the time in between to get more feedback from providers. And then on our January call, have a little more direction for the types of things that people want to work on. Again, I realize this is an incredibly busy time for providers. So I don't want to hem us in too much, that we're making all the decisions today. Like, I think there's going to be plenty of opportunities. But really it was more today to kind of get gut reactions where people feel that there could really be things that they want to move on in the near future.
Thank you, Annmarie. So I just wanted to basically ask whether the list is by importance, but it is not. Okay,
no, this was just usually as it came up in conversation. I did try moving things around here just from what I felt in this list here. I probably have stuff sorted over here that seems a little more, physical, logistical kind of needs. And over here is a little more of the coordination, but there wasn't an easy way to kind of bucket everything initially. And I think some of it, if we connect on a local level, can we work on dry and cold storage needs, right? Like there's a lot that could, we could come at them in different ways.
Thank you. Yeah, that makes sense.
Hi, just wanted to make a quick plug. This was a fantastic survey. I'm really happy to hear all this information. I see unified data collection system, and it sounds like there is, a desire to kind of share the burden of that intake. And just wanted to mention, for organizations who are partnering with Capital Area Food Bank, that is what the Service Insights system does. So it is an intake system that is shared by many of our partners, soon to be just about everybody, where each individual only has to register or do intake one time, and then that profile is able to be looked up by our other partners using that system. So it kind of saves everybody some time. It's kind of a universal kind of customer experience for the families coming to the pantries. So again, I'll put my email in the chat here. If any of our Capital Area Food Bank partners are interested, would love to share more about that.
Thanks, Samantha. And I'm sorry, I'm trying to keep up with the chat as well. But again, feel free if you have a question or a comment you want to share, feel free to raise your hand. Yeah, Dana, thank you so much. And I did also see a similar mention from Trisha about service provider guides. So we will have to look into those and see which ones exist and how providers can access those. And also, yes, again, like what the gaps are in those resource guides. Dana had also put in a plug for the hubs being anchors for regional and local coordination among food providers, and also with the county's regional offices. Yes, the regional service centers. So Any additional thoughts on that from other providers about connecting in a regional way, a regional local coordination way? And I'm going to sort through because I see so many providers on here today. I'm really excited. I saw some names I hadn't seen in a while. I know many of you have opinions, so don't be shy to share them. I see Ken Flemmer, unless someone else is using his account, who I haven't seen in forever. I won't put you on the spot, but thanks for being here today.
It's me.
It's you. Yep, Randy, thank you.
Annmarie, I have my hand raised, but I will come off mute.
Sorting through the list. Thank you. Yes, Michelle, please.
Well, first of all, I know that this was a lot of information for our team to take in partnership with the Office of Food Systems Resilience and many of you on this call. So just thank you so much for participating. And then thanks to Annmarie for compiling and summarizing. I'm going to stay off camera because I'm feeling under the weather today. But I feel like there's a lot that was presented, and I know this will be shared out in this community afterward. But I just wanted to emphasize that we are really interested in moving our work as the kind of community coordinator and facilitator of, some of this food assistance work to support this community in the best way possible. So any of those connections that we can kind of shift our work to ensure happen, we want to hear about that and get your feedback on. So I know Annmarie's highlighted these 2 points that kind of jumped out to us as opportunities to work on next year. But if you have additional ideas about what would be helpful, we'd love to hear it. And Annmarie, just from an advocacy perspective, from an earlier slide, I know that's sort of another part of our work is that we do a lot of advocacy for federal nutrition programs and some of the other work that was mentioned. And I just wanted to flag that is always work that we're doing here at the Food Council as well. And we welcome anyone to join us in those efforts. And if you're interested in getting more involved in our advocacy, feel free to reach out to me and I'll drop my email in the chat.
Thank you, Michelle, for sharing all of that and bringing that more into perspective after we're kind of working through all of these thoughts.
This is Jennifer Rinkema. I'm the food pantry director at Silver Spring Christian Reformed Church. And it was great to be part of these listening sessions, to hear what other providers had to say in them, and just feel that support of other providers in the community. I think it was really great to have that chance to have those conversations together, which actually kind of leads to my next point, which is I think the 2 things that Annmarie's highlighted here, the local provider coordination and provider peer mentoring, I think they're huge opportunities. We're, as a provider, we really can learn from others. So even as I was looking at some other things and listening to other parts of this conversation today, I was thinking about how some of us have moved, some providers have moved to appointment-based systems, Annmarie was mentioning, and I thought, wouldn't it be nice to hear how different providers are doing that? And so that's some of that provider peer mentoring that's just one example of how I think that could help. Is just bringing people who are doing that into a space to let us know how they're going about doing it, because it's a big change if you've never done appointments to figure out what system are you going to use? How are you going to get that information to your participants? Are they going to be able to use that system? There's a lot to figure out. So for those providers who have already done it and figured it out, I think being able to learn from each other is key. So that mentoring can happen, I think would be great countywide, because anybody who's figured it out can help anybody else. But I think there's this piece of this local provider coordination that's really key too, because we're located in the Wheaton area of Silver Spring, and I think that being able to be in touch with the providers that are serving the areas that we serve the most. So we serve people from all over the county, 70% of them come from very close to our distribution area. And so being able to coordinate and know what's happening with the providers who are the closest to us, what they're seeing, what they're doing, I think that would be really, really helpful. So I just wanted to put a plug in for those things. And I really enjoy working with other providers. So I think it gives us all energy and chances to learn from each other. Thank you.
Thank you so much, Jennifer, for sharing that. I definitely, like I said, I know it's hard. This is a lot to take in, but I really want this to be your space and what your, what the priorities are for you. We can kind of help identify themes that we've heard, in other areas and things that we can see kind of easily fit within the Food Council model. But we really want this to be what serves your needs best. Jenna.
Thanks, Annmarie. Can you hear me? Great. Yeah, I just wanted to build on what Jennifer said. I agree. We love working with other providers. I am curious what coordination means to each of us who probably said it, either on this call in the last few minutes or during the listening sessions or in the last decade that we've all been doing this work, decade plus. Because I think for me, the immediate thing that comes to mind is a little bit of what Jennifer said, which is just knowing each other, and knowing what it is we do and where we do it. That feels like basic level coordination, which we've not always been able to do, although many of us have been, part of efforts where we try really hard to. It's hard to stay up to date. It's hard to keep meeting with people. I understand. And then maybe there's, on the other end of the spectrum, is like coordination that actually means that one of us would stop doing a thing we were doing and do a different thing because there is another group doing something that impacts that. I know it was very vague, but I am curious, like, have you seen that happen? Have you as the provider done that because of some sort of external force that another provider brought up? We, for one example, the East County Hub, so shout out to Kingdom Fellowship, I don't know if they're on the call. I think they do a great job of regularly bringing together providers that work in the East County. To date, we've not actually made any changes, none of us that I'm aware of, despite the fact that, as an example, and I think Reverend Kendra, if she were here, would uplift the same example because we've been trying to work on it. At our Tech Road site, there's an apartment building right across the street where there is a regular grab and go distribution. We have our distribution right across the street 4 days a week on the first weeks of the month, 3 days other weeks. So we've thought, well, wouldn't it be great if Kingdom Fellowship could free up some of their resources and go to do a grab and go somewhere else if we could encourage the folks from that apartment building to utilize our services that are right across the street. I know I keep saying that it's right across the street. Did I mention it's right across the street? So we've all thought, well, that would be a great idea. But we've not been able, and not for lack of trying, we've just not really been able to make sure. And I think this is like the point I want to make. We've not been able to really make sure to each of our satisfactions that the individuals who are currently being served by that grab and go would feel adequately served if we removed that service and then tried, to encourage and to make people aware of the service here. So I think it feels easy for me when we look at a map and we say, oh, well, these two are so close together and they're doing the same thing. But then to actually make the leap to move things around, when obviously there's people's lives that are impacted very greatly by this, very hard to do. So I am curious, and maybe we can do like an impromptu poll in the chat. When you say coordination, what does that mean? I'm just curious. I'm curious for myself and I'm curious for everybody else.
I think while we take a second to think about that, and I have to think in my head what kind of poll I'm making, I wanna share. I heard someone on a radio show say this, and I'm sure I'm not getting the quote correct, fully correct, but I try to keep it in my head all the time. Paradigms are neat, and the world is messy, right? So my brain always tries to go to the rational, the logical, right? And then we try to actually do it on the ground, and 10,000 other things happen, right? That take us, and I think this is a perfect example of that. So I appreciate that, Jenna. But so what are we? I'm also happy because I can't think of an appropriate survey there. How about we just share in the chat? You know, what does coordination mean to you? And I'm happy to cut and paste all of these into a document that you get back at the end as well. But I'm seeing, let's see, aligning schedules to avoid duplication, seeing what's going on before offering new programs, just sharing information, learning from each other. Michelle.
I talked once, so I'll let Mary go first and then I'll go next.
Okay, Mary.
Oh, thank you, Michelle. I think the most important thing is that we drop the territorial attitude. We realize that you're out there to serve people who are in need, whether they jump from yours across the street to the next one across the street or down the alley. It doesn't matter. You, as a provider, are out there to serve the public and to help them get the needs that unfortunately USDA isn't providing at this time. So if as a provider you get out of the box and out of self and go and ask them, hey, look, we're doing this on Tuesday and Thursday. I see that you do this on Wednesday. How about if we all do this in a segment of I help you, you help me? Because we're all looking for volunteers. And it's work. We all know that. Done it for 10 years. But if Michelle's doing hers on Tuesday and Thursday, and I'm doing mine on Wednesday, I'll go ask her, can we come help you that you come help us so we can all do what it's there for? That's how cooperation and breaking the barriers. Because if we don't do this as a person, as providers, ain't nobody else gonna do it. I'm done, Michelle. You can have it now.
Thanks, Mary. I think you bring up great points as usual. I really appreciate you sharing. And I was just gonna, sorry, Jenna, for making fun of you in the chat about semantics, but I really appreciate everyone's feedback that's coming out of your question. And I would just push us to also consider coordination beyond the food system. So coordination with other service providers, such as, you know, housing, transportation, other things, because I think that's a big part of the place-based or local coordination that we've heard really needs to happen. And so it's beyond food system coordination, which, you know, we're trying to do, obviously, and, you know, moving beyond that to what's happening in zip code or regional areas with service provision beyond food specific services.
Thanks, Michelle. Anyone else? Any thoughts? All right. Well, like I said, I am, you know, we will be sharing the slides. I will be sharing the fuller narrative version of what I wrote up as feedback from the listening session. So you can have that, which goes a little deeper into some of those items. Like I mentioned, we are not going to have a call in December. But we will meet again in January, and I hope to pick up this topic again and kind of set an agenda for the new year of, what are things that we really want to work on together in this space. Hi, Pat. I see that you've joined us now. Again, I hope you'll be able to see the recording and see the resources. I did want to share a few other quick items before we let you get back to your day. I'm sorry, I've just got to bring up my notes. So just a few quick Food Council updates. So the supplemental appropriation request has been shared with Council and is on the consent agenda for tomorrow's session. I have a link to that I'll share in a moment in the chat. The hearing for the supplemental is tentatively scheduled for November 28th at 1:30 p.m. and community members are invited to present testimony. This is all great timing because on Wednesday, November 29th at 1 p.m., our advocacy community call, which Michelle and Jack on our staff host, will host members from the Office of Food Systems Resilience team to share more information about the special appropriation and answer questions from community members. We will also be featuring Tanya Stern, the acting director of the planning department, to share the importance of planning in the way our communities look, sound, and feel, including the way they impact our food system infrastructure. And I will share the registration link for that meeting in just a moment as well. So let me just get all of this in the chat. In the meantime, we have a few minutes while I'm moving stuff into the chat. If anyone has any community organization announcements they would like to share, happy to hear those either in the chat or feel free to speak. The floor is yours.
Hi, I wanted to I just put it in the chat, but this is Jenny Freeman from Community Farm Share, and we are hosting a fresh veggie drive. So the idea is that if you want to pass it out to anybody, or if you want to contribute as well, the idea is that people can purchase veggies from our local Montgomery County farmers, and that we're organizing that to get to some of our partners so that they it's like kind of a canned food drive, but fresh produce drive instead. So I put the info in the chat in case anybody can pass that along. That'd be great and support that. Thank you.
Thank you. One last thing I'm going to share in the chat. I know next week being Thanksgiving, we're already moving a little late, but I am sharing a link in the chat in a moment. If you are interested in sharing with us or with other providers what you are doing for holiday distributions, I do have a form here. Sometimes we do get calls of people looking for very specific items. They're looking for a turkey, they're looking for a chicken, they're just looking for if there's a special distribution. We know that many, if not all of you, are already at capacity. So I totally understand if you are not going to include your information here. But if you feel like you have room within your distributions and you're willing to take additional referrals for residents, please feel free to share that information in this form. And we are happy to share that back out with other providers, so you know where you can refer folks if you are at capacity, or also for our SNAP team to use as we might get calls from residents looking for particular items. So just wanted to put that there. Other than that, I think I'm going to give you 6 minutes back in your day, but thank you so much for coming today, for participating in this process, for taking the time. And I also know in the past couple of years, we've used our November call as a moment of appreciation. And I just wanted to express my appreciation to everyone on this call for everything that you do during the year, to serve people in the county, the expertise that you bring to this space, what you share with me, for us as the Food Council, to help you in your work. And I really look forward to kind of kicking things off in a slightly different direction next year and doing more work in this space with all of you, bringing back some in-person meetings, all that good stuff. So, you know, happy to hear your feedback. Pat, were you saying something and you're just on mute? Nope. Okay. But again, thank you for all that you do. Okay, Rainbow has some room in 20904 or 20901. Okay, great. But again, thank you so much. I hope you all have a wonderful holiday season, and I look forward to seeing you all again in January. Have a great day.
Thank you, Annmarie. Thanks, everybody. Bye-bye.
Thanks, Annmarie.
Thank you.